Welcome back to Foundation Physical Therapy's YouTube channel. Today we're going to go over an activity that helps with scapular stabilization, and it also helps with your upper extremity rotation. So basically any sport in which case you need to rotate, whether it be golf, tennis, even runners, to help with their stride if runners are limited in their thoracic spine or their upper back mobility, then a lot of times it'll affect their arm swing and that'll carry down the chain. So what you're going to do is first you're going to start out on a nice flat surface and you put your arms out to the side. For the purposes of the video, I'll only be rotating to the right, but you can go in both directions, and you'll need to pay attention to what my hands are doing because that does make a difference. So for starters, I'm gonna lay flat here. We're gonna rotate to the right. So if I'm rotating to the right, I want to take this right hand and place it palm down and leave my left hand palm up. What that's going to do is cue my posterior chain to kick in a little bit more. And then you're going to start by bringing the legs straight up like so. Okay? From this position, I want to start to rotate the legs to the right. And what I'm really concentrating on doing is keeping the left hand down, keeping the back of the arm down, keeping the back of the shoulder down. Once I get to a point where I'm going to lose that contact, I come right back. Right? And so if I start to lose contact here with the floor because I'm either starting to use my pec or I don't have sufficient strength to hold the back of this shoulder down, then I just come back. And then it's again, I go out as far as I can, and then I come back. Okay. Now this might be too challenging to start with, and if that's the case, that's why we have this nice little red ball right next to us. So if that's the case, then you can start with an exercise ball here to support, or if you find that you have any back discomfort with this. And then again, it's the same thing. You're here, this hand is palm up, this one is palm down, and I'm going to rotate as far as I can while maintaining the back of my left arm and my left shoulder blade on the surface. Then I'm going to come back. Okay? And then again, you would alternate sides, flip the hands over, and then come back towards this direction. And what you do here is not necessarily a set number of repetitions. You do as many as you can with good form and then try to build on that. But it's a great scapular stabilization activity. It's a great thoracic rotation mobility, and it's actually surprisingly challenging.